Atherosclerosis is a chronic inflammatory disease characterized by formation of fibrofatty lesion in the blood vessel, and it accounts for about 50% of all deaths in westernized society. And the systemic changes detected in atherosclerosis are closely similar in the aorta, coronary arteries, and carotid arteries. And atherosclerotic cardiovascular disease can present as either coronary artery disease or CVA or TIA or peripheral arterial disease, or it can involve the abdominal aorta causing aneurysm or renal artery causing renal artery stenosis. Hyder et al. Demonstrated that more than mild plaque at any site of the thoracic aorta predicts all-cause mortality. And thoracic aorta atherosclerosis can be imaged by transesophageal echocardiography or CT angiography or MR imaging. TE provides high-resolution imaging of the thoracic aorta and is a reliable tool for evaluating the degree of thoracic aortic atherosclerosis. For diagnosis of coronary artery disease, coronary angiography is considered as the gold standard, and the Synt score is an angiographic tool to grade the complexity of coronary artery lesion. So aim of my study is detection and grading of atherosclerotic plaque in the descending thoracic aorta in patients with coronary artery disease by transesophageal echo, and its correlation with severity of coronary artery disease through angiography using Synt score. So it is an observational descriptive cross-sectional study involving 50 patients. Inclusion criteria are patients with acute or chronic coronary syndrome who are age group is less than 65 years and who are hemodynamically stable. And exclusion criteria are patients with ongoing chest pain, arrhythmias, uncontrolled hypertension, or any signs of active infection. And those patients having a history of any upper GI pathology like esophageal stricture or varices or tumor are excluded, and patients having renal failure in which angiography is difficult, they are excluded. In all patients, TE was done, and imaging of the descending thoracic aorta with TE is easily performed because aorta is immediately adjacent to the esophagus, and from the transaortic long axis view, probe is withdrawn up to the diaphragm and rotated counterclockwise. Then imaging of the descending thoracic aorta is obtained in both short axis and long axis view. Then atherosclerotic lesion of the descending thoracic aorta are graded according to modified scoring system originally proposed by Fazio et al. Grade 0 is no signs of atherosclerosis, grade 1 intimal thickening, grade 2 plaque less than 5 mm, and grade 3 include plaque more than 5 mm or complex plaque with ulcerated or mobile part. And grade 2 and grade 3 are considered as significant atherosclerosis. And this picture shows the different grades of aortic atherosclerosis. This one is grade 1 only intimal thickening. This is grade 2 having plaque of less than 5 mm, and this is grade 3. Both are grade 3. This is plaque of more than 5 mm. This is ulcerated plaque. And all patients were undergone coronary angiography for assessment of coronary arteries, and Synt score was calculated. And Synt score is the sum of the points assigned to each individual lesion identified in the coronary tree with more than 50% diameter stenosis in vessel, those who are more than 1.5 mm. Then statistical analysis was done with SPSS version 26 software, and this shows the grading of aortic atherosclerosis. As the grading increases, the mean Synt score is increases. With grade 0, the mean Synt score is 10. With grade 1, the mean Synt score is 18. With grade 2, mean Synt score is 26. And with grade 3, mean Synt score is 44. And here the Spearman correlation coefficient is 0.58, which shows moderate positive association, and p-value is 0.01, which is statistically significant. So grading of aortic atherosclerosis shows a statistically significant positive correlation with Synt score. So the purpose of our study was to determine whether TE imaging of non-coronary vascular structure could accurately predict the presence and severity of CAT detected angiographically. Our results showed that thoracic aortic plaque detected on TE study appeared to be a useful marker for predicting the presence and severity of CAT. These findings are consistent with the observation of Fazio et al. And further substantiate the concept that atherosclerosis is a generalized process. One study showed the risk of systemic embolism caused by guide wire during transfemoral catheterization was 0.1% overall, but 27% in patients with complex atherosclerotic plaque and debris. So the identification and location of plaque on TE may help to decrease the risk of atherosclerotic complication prior to cardiac intervention or the morbidity associated with it. The aortic atherosclerosis is a component of CHARTS-2 score for the risk of stroke in patients with atrial fibrillation and may be an indication for treatment with anticoagulation according to recent guidelines for the management of AF. Limitation of the studies: we have taken all patients having symptoms of CAT, so these results were not comparable to general population. and this is a relatively small size and single-centered study, and we have imaged only the descending thoracic aorta through TE. Conclusion: severity of aortic atherosclerosis can be positively correlated with severity of CAD using syntax score, and assessment of atherosclerotic lesion in all segments of thoracic aorta should be the part of every routine TE examinations. These are my references. Thank you.